Welcome back to the Deep Dive. Today, we are pulling the lens way back on one of the most consequential, yet I think often overlooked, entities in the American financial and healthcare landscape.
I agree with that.
We're talking about Centene Corporation. And we're not talking about a pharmaceutical company or, a hospital chain. We are diving deep into the world of managed care, the massive business of being the intermediary for government healthcare.
And when we say massive, we really mean colossal. Centene acts as this critical bridge, this coordination engine between billions of dollars in taxpayer funding and millions of patients and providers.
Exactly.
For anyone seeking to understand where public money meets private profit in the U.S. health system, the Centene story is basically mandatory reading.
Our listeners provided a pretty substantial stack of sources, primarily focusing on the company's corporate history and its regulatory exposure. So our mission today is complex, but I think clear. We need to chart Centene's entire trajectory. We'll look at the incredible scale they've achieved. The numbers are, frankly, staggering. Examine the relentless acquisition strategy that built this behemoth. Understand the recent, almost tectonic shifts in leadership and strategy.
And I think most importantly, dissect the massive financial settlements that have consistently tied the company's profitability to allegations of overbilling and network failure.
Yeah, that last part is key.
We really have to establish the sheer magnitude of this company immediately because it sets the context for absolutely everything else we're going to discuss. Centene is an American for-profit healthcare company headquartered in St. Louis, Missouri.
And looking at the 2024 figures, the scale just becomes breathtaking.
It really does.
Okay, so let's unpack this. We are talking about annual revenue of U.S. $163 billion as of 2024.
$163 billion.
It's an enormous figure.
Well,
it places them at number 23 on the 2025 Fortune 500 list. That's not just a major player in healthcare. That is one of the top 24 corporations in the entire United States.
You're putting them up there with tech and energy giants.
Yeah.
That's the league they're in.
And to support that kind of scale, they employ 60,500 people.
And their core operational model is what makes that size so relevant to the public discussion. They are predominantly an intermediary for, and this is the important part, government-sponsored and privately insured healthcare programs.
Right.
This means the engine driving that $163 billion revenue stream is fundamentally reliant on public dollars. We're talking primarily about programs like Medicaid and Medicare.
So their business is basically managing the risk associated with these colossal public programs.
Exactly, transforming what was intended as a public responsibility into a highly, highly lucrative private sector industry.
And that intersection, public funding and private profit maximization, that is the central tension of this entire deep dive. It's a dynamic we'll see repeated in their history, their acquisitions, and ultimately their settlements.
Absolutely.
To truly understand Centene, we first need to look at how this Fortune 500 giant emerged from incredibly humble and I think surprisingly nonprofit roots.
The Centene story is not one of a Silicon Valley startup. It starts way back in 1984.
41 years ago.
Right, 41 years ago in Milwaukee, Wisconsin. It was founded by Elizabeth Betty Brin, and it wasn't even called Centene. It was originally known as Managed Health Services.
And it was a nonprofit.
A nonprofit entity focused locally on providing essential care and coordination.
This foundational stage-managed health services as a nonprofit is just essential context, isn't it? It means the company's initial mission was centered on community benefit and accessible care, a really stark contrast to its eventual identity.
A completely different world. But the pivotal shift comes after Brin's death.
What happens then?
The organization was subsequently sold to investors, and that marks the definitive transition from a nonprofit structure to a for-profit enterprise. This sale is the inflection point where Centene, as we know it today, truly begins.
But there's an interesting layer to this, right? The proceeds from that sale weren't just, pocketed.
No, and this is a fascinating detail. They were used to fund the Betty Brin Foundation, an organization that, in turn, became a major shareholder in the new for-profit Centene Corporation.
That creates a really complex, almost circular relationship, doesn't it?
It does.
The foundation that's built on the nonprofit's original assets maintains a financial stake in the success of the for-profit successor. It sort of institutionalizes the link between the company's charitable origins and its new financial objectives.
It's a very unusual setup, and the person who truly guided the company through its critical growth phase was Michael Neidorff.
Right. He joined as CEO in 1996.
And just 5 years later, under his leadership, Centene went public. They had an IPO in December of 2001. That move, going public, it really signaled an intention to aggressively expand and seek capital for large-scale operations.
And the early strategic acquisitions they made sort of set the template for the later controversies, didn't they? They weren't just acquiring other health plans, they were strategically integrating control over the supply chain.
That's a great way to put it. In 2006, they acquired US Script, which was a pharmacy benefits manager, or a PBM.
And this is a crucial detail for the listener to remember, right? PBMs.
Absolutely. PBMs are the middlemen that manage prescription drug benefits for health plans. They're the ones negotiating with drug manufacturers, creating the formularies, processing the claims.
So controlling the PBM segment, which they later merged into their involved divisions, gave Centene just massive leverage.
Massive.
It meant they could manage prescription costs, control the rebates, and dictate how drug reimbursement functioned within their own managed care plans. It's a classic example of vertical integration.
Designed to maximize efficiency and critically profitability from the drug pipeline.
So while they were securing that drug supply chain, they also moved into these highly specific, guaranteed government markets.
Right. In 2011, they formed Centurion. This was a joint venture with a company called MHM Services, and its whole purpose was to provide correctional healthcare services.
Correctional health. So we're talking about healthcare in state and county jails and prisons. It's a captive market.
Exactly. It's a specialized, often controversial sector, but it's a critical line item in state budgets, which guarantees a steady revenue stream for the contractor.
And they solidified this focus in 2018, didn't they?
Yeah.
By acquiring MHM Services outright.
They did. They bought the rest of it, integrating correctional health fully into their portfolio.
But the true springboard, the thing that really launched Centene to its current scale, was the Affordable Care Act, the ACA.
No question.
Yeah.
Starting in 2014, Centene moved so aggressively to offer state-run Medicaid programs through the new ACA exchanges. This was a very deliberate, strategic decision to plant their flag firmly in that expanded, government-funded healthcare market.
This shift wasn't just about diversification. It was about capitalizing on a fundamental change in the U.S. healthcare environment, the massive expansion of managed Medicaid, and the introduction of the ACA marketplaces.
And all of that groundwork, the IPO, the PBM integration, these specialty markets, and the aggressive move into the ACA, it just perfectly sets the stage for the next phase.
Which was pure, unrelenting market dominance through acquisition.
Just an incredible shopping spree.
So if the first 2 decades were about, positioning and these foundational moves, the mid-2010s were about exploding the scale. The acquisition spree Centene undertook wasn't just growth. It was a systematic consolidation of rivals and specialized markets.
Indeed. I mean, it dramatically increased their market footprint and, as a result, their complexity and their regulatory exposure. The initial major leap happened between 2015 and 2016.
Right. They announced plans to acquire HealthNet in 2015, a colossal transaction. I think it was valued at around $6.8 billion.
A huge deal. And that finalized in March 2016. At the same time, they were also acquiring Trillium Community Health Plan up in Oregon.
And HealthNet brought Centene vast new markets. But as we'll definitely get into later in the controversy section, it also brought along some significant baggage.
Oh, absolutely. And just a year later, in 2017, they continued this pattern of just absorbing these regional nonprofit giants when they acquired Fidelis Care.
Fidelis was a nonprofit insurer in New York, right? For what? US $3.75 billion?
That's right. It's fascinating. Centene consistently found value in converting these established nonprofit entities, which often had deep ties to specific populations, into parts of their for-profit machine.
It's a mechanism for immediate large-scale patient enrollment. You just buy the customer list, basically.
It is. But the acquisition that truly cemented their status near the top of the managed care hierarchy came in 2019.
The planned acquisition of their rival, WellCare.
The WellCare deal was an industry tremor. It was valued at a staggering $17.3 billion.
$17.3 billion.
This was just an aggressive move to eliminate a major competitor and consolidate their position, particularly strengthening their presence in Medicare Advantage and Medicaid programs.
When you just add up those purchase prices, $6.8 billion for HealthNet, $3.75 billion for Fidelis, $17.3 billion for WellCare, it demonstrates a corporate strategy that is utterly dependent on massive capital deployment for market dominance.
They were buying their way to the top.
And their acquisition strategy didn't stop at general insurance. They recognized a growing strategic need for specialization, which led to the 2021 acquisition of Magellan Health.
Yes, Magellan Health was a very targeted acquisition. It was for $2.2 billion, completed in January 2022, and this established a major behavioral health platform for Centene.
So this wasn't just about getting bigger, it was about strategic depth.
Exactly. Behavioral health, so mental health and substance abuse services, it's a specialized high-growth area. By integrating Magellan, Centene gained expertise and infrastructure to handle that specialized care coordination.
Okay, so domestically, they were executing this unrelenting, hyper-aggressive acquisition strategy. But they also tried to take this model global, which resulted in a really fascinating subplot.
Their foray into the UK market and their subsequent retreat.
Let's talk about that.
So the UK expansion started around 2017. Centene aimed to export their managed care model into the UK healthcare system, which is, dominated by the National Health Service, the NHS.
A single-payer public system. So it immediately placed Centene in a very politically sensitive environment.
Incredibly sensitive. And through their subsidiaries, they targeted two key areas. First, private hospitals. In 2019, they acquired a 40% stake in Circle Health through a subsidiary, eventually taking full control by July of 2021.
And that gave them a network of, over 50 private hospitals?
That's right. But second, and perhaps even more controversial, was their deep involvement in NHS primary care. Their UK subsidiary, Operose Health, systematically acquired general practitioner or GP practices.
And in 2021, Operose took over AT Medics, which is a large group of London GP practices.
And it grew quickly. By 2022, Centene, through Operose, was the largest supplier of GP services to the NHS.
The largest.
The largest, covering almost 600,000 patients. To be the largest private entity managing primary care within the public NHS structure. It's not just a matter of scale.
It's a political lightning rod. I mean, did they really anticipate the intense public scrutiny this profit-driven approach would generate within a system that's built on a public service ethos?
Well, clearly the intense political and operational pressure was not worth the trouble in the end because the global expansion proved to be very short-lived. Just 2 years after gaining full control, Centene sold Circle Health to a company called Pure Health for $1.2 billion in August 2023. It signaled a decisive exit from the UK market.
It seems like the friction inherent in trying to apply a highly competitive, profit-maximizing model to a deeply entrenched public health service, it just proved unsustainable.
It did.
That quick entry and rapid exit consolidating, facing intense scrutiny, and then just divesting is highly illustrative of Centene's corporate style, isn't it?
I think so, yes.
So, having covered the growth, let's summarize their current business profile for a listener. What is the portfolio that generates that $163 billion today?
The current portfolio clearly shows where Centene's reliance lies. It's government contracts.
Okay, so first and foremost is Medicaid, which serves low-income individuals and is often administered by states through private managed care organizations like Centene. This is their bread and butter.
Absolutely, their core business.
Second, the ACA health insurance marketplace, where they offer plans under well-known brands like Ambetter.
Third is Medicare, mainly through their Medicare Advantage plans, which are the privately administered versions of the federal program.
Fourth, TRICARE, providing services for military families and veterans, often through subsidiaries like HealthNet Federal Services.
And fifth, the correctional healthcare segment we discussed earlier, servicing those state and county contracts.
When you look at that list, you realize that Centene is not just participating in government healthcare. It is structurally intertwined with it. Any significant shifts in public health policy, whether it's Medicaid expansion, Medicare reform, military healthcare budgets, it directly impacts this company's bottom line.
Which is why their scale makes their leadership and their strategic financial maneuvers so incredibly important to scrutinize.
Exactly.
The whole narrative of this hyper-aggressive growth and consolidation is completely inseparable from the tenure of Michael Neidorff, the longtime CEO.
Right. He built the empire.
He did. But the financial realities of that empire, and particularly his own compensation, became a major flashpoint, especially as the company was simultaneously dealing with government lawsuits.
The figures really put a harsh spotlight on the inherent contradiction of managing care for the nation's poorest and most vulnerable while running a massive for-profit enterprise. In 2021, the Ohio Capital Journal reported that Michael Neidorff was, in 2020, the highest-paid healthcare executive in the United States.
He was, earning nearly $25 million that year.
$25 million.
In annual compensation, earned overwhelmingly by managing taxpayer-funded programs like Medicaid. That salary provides the sharpest illustration of the core tension we've been talking about.
The efficiency and cost control demanded by government contracts translates into just staggering wealth for the executives running the managing entity.
And that high profile and all the accompanying controversies, it inevitably attracted attention from outside market forces looking to maximize shareholder value.
Which brings us to December 2021. The activist investor Politan Capital Management took a substantial stake in Centene, valued at $900 million.
And this is a classic narrative of activist investor intervention, right? Politan wasn't just interested in a passive investment. They typically seek to push for significant operational changes.
So they saw Centene, despite its massive revenue, as potentially inefficient and carrying unnecessary baggage.
That's right. Specifically, operational complexity and mounting legal liability.
The consequences were almost immediate. Following Politan's engagement, CEO Michael Najdorf announced plans to retire by the end of 2022.
This wasn't a quiet handover. This was a management shakeup driven by external pressure demanding a strategic cleanup.
And the change formalized swiftly. In March 2022, Sarah London, a seasoned technology and healthcare strategist, was named the new chief executive officer.
And this leadership change was inextricably linked to a shift in corporate priorities. They were moving from pure acquisition and growth dominance to efficiency and, critically, risk mitigation.
That transition coincided with what I view as the single most critical strategic shift of the last few years.
The decision to exit the pharmacy benefit management business entirely.
Exactly.
This needs to be viewed not just as a business decision, but as a strategic amputation. Remember, we traced the PBM business all the way back to the 2006 acquisition of US Script.
It had been central to their ability to control costs and maximize profit margins internally.
It was core to the model. Yet in May 2022, Centene announced they were shedding this entire segment.
They executed a major divestiture, selling off Magellan Health and Pantux Rare for a total of $2.8 billion.
They essentially cashed out of the PBM game.
And the timing here is everything.
Everything. This divestiture occurred precisely as the company was facing and agreeing to hundreds of millions of dollars in settlements related specifically to allegations of overbilling and transparency issues tied to their PBM subsidiary Involve.
So they offloaded a segment that had become an untenable legal and financial liability.
And injected $2.8 billion in fresh capital into the company just as they were dealing with the fallout. The narrative shifted from, we control the drug supply chain, to, we have to shed the function that is attracting massive regulatory fines.
So the new leadership inherited a $163 billion machine that required immediate structural cleaning. You have an aggressive acquisition strategy, a $25 million salary for the outgoing CEO, and a strategic retreat from a core business unit.
Which brings us directly to the pressure points, the specific cases that put the profit motive up against patient care and legal accountability.
The conflicts Centene faces often serve as these perfect case studies in the tension inherent in managing essential public services for private profit. The first major pressure point involves claims of restricted patient access and network adequacy.
And the 2014 Texas infant surgery case received widespread media attention. It really highlighted the human cost of these bureaucratic battles. It focused on Superior Health Plan of Texas, which was a Centene joint venture serving Medicaid recipients.
The core allegation was just devastating. Superior Health Plan denied coverage for an infant's necessary brain cancer surgery at Texas Children's Hospital.
And what made the case particularly frustrating, according to the reports, was that the plan had previously paid other health care claims for the same infant at that specific facility.
So the denial seemed completely capricious, or at least related to some shifting internal coverage rule.
It highlights this terrifying reality, right? When profit optimization meets life-saving care, it's the most vulnerable families who are forced into these desperate administrative fights.
And the power dynamic only shifts when external pressure mounts. 3 days after the story broke on Fox News, Superior Health Plan reversed its decision. The surgery was covered.
Which is great for that family, obviously, but it showed that sometimes the only way to puncture that corporate armor is through public outcry.
And these access issues weren't just confined to Medicaid. They extended into Centene's ACA marketplace brand, Ambetter.
Yes, in January 2018, a class action lawsuit accused Ambetter plans of misleading enrollees about the actual benefits they were purchasing.
The core of this class action centered on network adequacy, right?
Exactly. Enrollees in Ambetter plans had extreme difficulty finding medical providers, especially specialists, who would actually accept patients under those policies.
Which strongly suggests that Centene may have created what are called narrow networks, where the patient enrollment looks good on paper, but the functional access to care is severely restricted to keep costs low.
It raises a really fundamental question of value. If a health plan is affordable because its network is so restricted that patients can't actually access necessary specialists or hospitals when they need them, is the plan truly providing the comprehensive coverage it promised?
And the lawsuit argued that by concealing the functional inadequacy of the network, Centene was engaging in deceptive practices.
Right. And the controversies also reached the executive suites and the shareholder level following one of those massive acquisitions we discussed.
This was in December 2018. Two pension funds filed a lawsuit against Centene related to the $6.8 billion HealthNet acquisition from 2016.
And this shareholder suit alleged that Centene concealed substantial liabilities from its investors during the merger process. Specifically, they claim that HealthNet owed approximately $1 billion in past tax liabilities to the state of California.
$1 billion in back taxes.
And was concurrently under investigation for Medicare fraud at the time Centene acquired them.
Wow. So if those allegations hold, it means Centene acquired a company that was significantly more leveraged and legally volatile than they represented to the public and to their own shareholders.
It exposed the combined entity to massive financial and legal liability immediately after the deal closed. It just demonstrates the complex, high-stakes risk inherent in these aggressive consolidation strategies.
And finally, we have to revisit the international market and the intense scrutiny Centene's UK subsidiary, Operose Health, faced over its management of NHS primary care services. Scrutiny that, I think, likely contributed to their eventual retreat.
No doubt. By 2022, Operose Health was serving nearly 600,000 NHS patients, making it the largest private supplier of GP services in the country.
And they were quickly accused of prioritizing profit at the expense of patient care quality.
The structural accusation was centered on their staffing models. Operose was reportedly hiring cheaper physician associates instead of more expensive, fully qualified GPs or general practitioners.
And the specific data cited by sources was alarming. The average number of full-time equivalent GPs per patient at Operose practices was about half the average found in other English practices.
Half. That is not a minor deviation. That is a fundamental operational shift designed to minimize labor costs.
Half the average staffing level for the most critical primary care position? I mean, that suggests a system that is just stretched dangerously thin.
And concerns were formalized by prominent NHS figures like Sir Sam Everington. He highlighted worries about physician associates not receiving the necessary supervision. Furthermore, reports surfaced of massive backlogs.
Backlogs.
Thousands of medical test results and hospital letters reportedly just piling up on computer systems due to understaffing.
That backlog is the tangible manifestation of under-resourcing, isn't it?
Yeah.
Delayed test results and correspondence directly translate into risks for continuity of care and patient safety.
It does. However, Centene's defense, via Operose, was that their practices maintained high standards. They cited that 97% of their practices were rated good or outstanding by the Care Quality Commission, or CQC.
Wait, hold on. If they were accused of running on half the average number of GPs and allowing massive administrative backlogs, how could they simultaneously maintain a 97% good or outstanding rating?
That's the million-dollar question.
Doesn't that suggest a profound disconnect? Perhaps a flaw in the CQC rating system itself, if the quality ratings don't immediately capture critical staffing inadequacies.
It raises a vital regulatory question. Quality ratings often look at formal processes and, patient satisfaction metrics, which can lag behind or fail to capture systemic under-resourcing like physician staffing ratios.
So the ratings might be focusing on the surface level. The clinic looks good, the processes are defined, while missing the operational reality that core staff is severely minimized for profit, creating a latent risk.
I think that's a very fair assessment. And this scrutiny was undeniably a key factor in Centene's decision to exit the politically charged UK market shortly thereafter.
Regardless of the ratings, these domestic and international pressure points ultimately resulted in the most concrete consequence: massive, sustained financial penalties levied by various state and federal entities.
And this final part is really the climax of Centene's history. It's where the aggressive acquisition of government contracts meets regulatory oversight, resulting in financial settlements totaling well over $300 million in just the last few years.
Let's start at the federal level, focusing on the TRICARE sphere. In April 2021, Centene's subsidiary, HealthNet Federal Services, which manages TRICARE claims, paid $97 million to settle allegations related to claims submitted to the Department of Veterans Affairs.
And the specific allegation was that the subsidiary duplicated or inflated claims submitted to the VA. The Department of Veterans Affairs, or VA, is one of the nation's largest single-payer systems, and when a contractor systematically manipulates billing,
Whether through duplication or inflation.
the penalties are designed to be punitive, hence the nearly $100 million settlement.
Okay. Now, we dive into the core source of the systemic issues, that PBM segment, involve, which Centene strategically shed.
Between June 2021 and January 2022, Centene faced an absolute wave of settlements from multiple states regarding Medicaid overpayments tied directly to its pharmacy benefit manager subsidiary.
The collective total of these settlements quickly surpassed $191 million.
Right, encompassing agreements reached with states like Ohio, Mississippi, Illinois, Arkansas, and New Hampshire. The sheer volume and consistency of these claims across diverse state Medicaid systems suggest a widespread structural issue.
The nature of the allegation is resolving claims of overpayments from state Medicaid programs to the PBM. For the listener, we really need a clear explanation of how this mechanism works. This is crucial for understanding the PBM controversy.
It is.
Okay, so let's try to simplify the mechanism of PBM overbilling. Imagine the state Medicaid program pays Centene, the PBM, $100 for a prescription drug. That $100 is taxpayer money. Centene, because of its huge negotiating power, then goes to the drug manufacturer and secures a rebate, let's say $30, which means the actual cost to Centene was only $70.
And the core allegation in these lawsuits is that Centene's PBM subsidiary failed to fully disclose that $30 rebate to the state. They would report the cost as being, for example, $90, effectively concealing the full discount they received.
And then Centene would just pocket the difference between what the state paid them and the true net cost after rebates. It's essentially double dipping on taxpayer funds and generating excessive profit from public programs.
Exactly. The settlements were reached because states alleged Centene had improperly maximized its earnings by failing to provide the full transparency required under their Medicaid contracts.
That distinction between the gross price, the net price, and the transparency or lack thereof is the absolute key to understanding these settlements.
It is.
Let's look at two specific state examples that illustrate the strategies Centene was accused of using. In December 2021, Centene paid $27.6 million to the state of Kansas.
And the Kansas settlement explicitly centered on allegations that Centene obtained greater profit from Kansas's Medicaid program by failing to fully disclose discounts it received and by employing other strategies to maximize its earnings from the publicly funded program.
So it's the same pattern. It highlights the inherent opacity of the PBM business model, where a lack of transparency regarding rebates and discounts results in states feeling they're being overcharged for essential services.
And similarly, in September 2022, Centene paid over $14 million to Massachusetts.
Let me guess.
This resolution addressed claims that Centene overcharged the state Medicaid program, known as Mass Health, for pharmacy benefits and services. The pattern is crystal clear.
Across diverse geographic and political landscapes, the same PBM subsidiary was accused of improperly maximizing revenue at the expense of the state's Medicaid budget.
And the cumulative effect of these cases, totaling hundreds of millions, it just underscores why the PBM segment became a strategic liability that the new leadership decided to exit.
Finally, the Florida case. This one provides a unique twist in this financial reckoning. Centene overbilled Florida $67 million in 2021, but in a departure from the other cases, which required state intervention.
Centene proactively notified the state of the overbilling.
Right, proactive notification. That's a noteworthy detail, isn't it? It suggests a possible shift in compliance, or maybe just a recognition that the liability was too large to conceal.
Could be either. And following extensive discussions with the Agency for Healthcare Administration, or AHCA, Centene agreed in 2024 to return the entire $67 million.
But here's the twist that requires some extra analysis. $10 million of that total refund was sent to the Hope Florida Foundation rather than being returned directly to the state treasury. Why is that significant?
That is highly unusual in financial settlements involving public funds. Typically, when a corporation is found to have overbilled a public entity, the recovered funds revert to the state treasury.
Right, to offset the previous loss to the general budget or the specific Medicaid account.
Exactly. Diverting $10 million to a specific foundation, even one dedicated to public welfare, introduces this layer of political complexity regarding how public funds recovered from fraud or overbilling are managed.
It transforms recovered funds from a budget correction into a discretionary funding allocation.
It does. So if we step back and synthesize this whole financial picture, over $300 million in settlements for inflated claims, concealed discounts, and overbilling of government programs, it firmly connects the aggressive pursuit of government contracts with the financial liabilities that ultimately forced a major strategic retreat under the new CEO.
The price of maximizing profit in the public sector is clearly very, very high.
So if we synthesize everything we've explored today, the defining characteristic of Centene Corporation is really its dual identity. It is simultaneously an indispensable, massive intermediary for essential government health programs, Medicaid, Medicare, TRICARE enabling millions of vulnerable Americans to access managed care services.
Yet that exact structure, this massive scale, so deeply reliant on public funding, has consistently exposed the company to severe regulatory scrutiny. The narrative is one of unrelenting growth financed by aggressive acquisitions.
Followed by over $300 million in sustained settlements and penalties, almost always tied to allegations of manipulating the profitability mechanisms inherent in their government contracts, particularly through their now divested PBM operations.
And the company's story, it just encapsulates the entire debate around the privatization of public health services, doesn't it?
It really does. We trace the lineage from a small nonprofit foundation in Milwaukee to a Fortune 500 powerhouse in St. Louis. And this progression is so sharply symbolized by the fact that the outgoing CEO was the highest paid healthcare executive in the nation,
Earning $25 million in a single year.
while the company simultaneously navigated a wave of settlements for overbilling the very public programs that generated that revenue.
And the strategic decision to exit the PBM business, the core engine of some of the overbilling allegations, it just confirms that the liability associated with that structure was deemed too toxic to maintain, forcing a massive multi-billion-dollar strategic amputation.
So what does this all mean for you? Since Centene's business segments rely overwhelmingly on taxpayer-funded public programs, this sustained pattern of massive settlements for overbilling government entities raises a critical question about the necessary checks and balances.
We encourage you to consider this provocative thought. When a single corporation is managing tens of billions in public healthcare funds, a corporation whose business model led to hundreds of millions in settlements because of inadequate transparency and alleged manipulation of discounts, what structural safeguards or regulatory intensity are truly necessary to ensure that the pursuit of private profit does not perpetually compromise the integrity and cost efficiency of vital public welfare programs?
This is not just a story of corporate finance. It's a story of public accountability tied directly to the size of the company and the source of its staggering revenue.
And that's a dynamic worth keeping a close eye on.